Anastasia Coutinho. I am a medical consultant in our quality and population health program. And so I am a family physician by training, and prior to DHCS worked at a federally qualified health center providing care there. And at DHCS, I lead the implementation of our birthing care pathway policies and our quality improvement around maternity care with our managed care plans. And today we'll be talking about the birthing care pathway report and a 1-year update. Next slide, please. So the birthing care pathway report was released last year in February of 2025 after a culmination of work between 2023 and 2025 that really dived into what members need during the pregnancy and postpartum period. And that work included focus groups with members, provider groups, community advocates, a number of subcommittees that focused on clinical care, postpartum care, and social determinants of health issues related to the pregnancy and postpartum period, and also included some member journey mapping and journaling, and led to the production of this report that creates a comprehensive policy and care model roadmap that really identifies how DHCS thinks about the journey of all pregnant and postpartum members from conception until 12 months postpartum. And the report included a series of policies that DHCS committed to help address members' physical, behavioral, and health-related social needs. We have a number of reports, including the birthing care pathway report, our comprehensive care strategy, our bold goals initiative, and others that really aim to reduce maternal mortality and morbidity and address the significant racial and ethnic disparities that we know exist within our state. Next slide, please. And so when this report was published, it summarized the current state of maternal health in Medi-Cal, findings from what I had mentioned previously from our member engagement and focus groups, provided an overview of how all of that was conducted, and then discussed the policies that DHCS had already implemented and was planning to implement moving forward, as well as identified strategic opportunities for further exploration. So today we're really going to focus on that bolded line to discuss the progress that's been made in the past year since the publication of that report and the policies that DHCS has implemented. Next slide, please. So the birthing care pathway report identified 42 policies that DHCS committed to, and you can see here we've now completed 29 of those policies, and the remaining 13 are in progress, with a couple hopefully to be finished out by the end of this quarter, and continue moving forward with all of the policies aimed to be complete by December of 2026. Next slide, please. This is just a new web page that we've created that if you're looking for more information, that this goes through policy by policy, identifies whether it's complete or in progress, and then lists the ongoing work or the publication that has led to that policy being complete. And so if you're interested in diving a little bit deeper into all the policies, since we won't go into every single one today, we can put that link in the chat at the end of the presentation. Next slide, please. So let's start with just some of the policies that have been completed. And so one of these really focused on improving communication to pregnant and postpartum members, and through a number of initiatives. And so creation of member fact sheets, changing and creating new member web pages, some social media endeavors that were released last year and continue to be ongoing, as our first presentation saw, around different topics, but including pregnancy and postpartum health, and then updates to the My Medi-Cal page for members to access. Next slide, please. So there were 2 member fact sheets that were created last year, one about finding the right care team for your pregnancy, which really identifies the differences between doctors or physicians, including OBGYNs and family physicians, who both can provide pregnancy and postpartum care, midwives, who provide the full scope of pregnancy and postpartum care, with many providing gynecologic care, and then doulas, and how each of those can contribute to supporting a healthy pregnancy and postpartum period. And then the second fact sheet for members was really about the services that individuals can get through Medi-Cal that might relate to the pregnancy and postpartum period. And some of the care that we provide is available, throughout just an adult journey, regardless of pregnancy, but some benefits really kick in during the pregnancy and postpartum period, such as, childbirth classes, parenting classes, supports around lactation for breastfeeding and nutrition, some additional eligibility for enhanced care management or community supports, et cetera. And then we wanted to really highlight some of the other community-based partnerships that our other state agencies provide, like WIC, HealthFresh, Black Infant Health, that are all provided through the California Department of Public Health and California Department of Social Services, as well as paid family leave. There are also other community-based organizations that provide services to pregnant and postpartum individuals that are not necessarily on this sheet. And so these are both available to pass out to members, just so that they are able to ask their provider or their Medi-Cal plan for support in these areas, knowing that these are the benefits that they get during that time period. Next slide, please. Then we made some updates to the My Medi-Cal website on how to use Medi-Cal benefits within the pregnancy and postpartum period. And again, as I mentioned, because some of those benefits do change during pregnancy, we wanted to ensure that those members were able to understand the specific benefits during that time period. Additionally, we know that many individuals become Medi-Cal members once they're pregnant and have not received health insurance previously. And so really targeting anybody who is new to Medi-Cal to be able to understand the full scope of benefits and services that we provide. Next step. So another policy and a number of policies in the birth and care pathway focused around doulas. And we know that doulas are a critical part of supporting members through their pregnancy and postpartum journey. And so the benefit, while it had been established prior to the birth and care pathway report, included a number of ways to make doulas more accessible within the report that we had committed to. There was an ongoing doula implementation stakeholder work group that finished last year. That work group that was comprised of doulas, healthcare providers, consumer and community advocates, health plans, county representatives, tribal representatives, and others really worked to create the benefit, hold DHCS accountable to making sure that members were getting what they needed, and then also continue to work with our benefits division to inform ongoing work around the doula benefit. At the conclusion of the work group last year, there was also the creation of a report, both from the doula implementation work group itself, about how they planned to continue to improve the benefit or recommendations to DHCS and the legislature about ways to improve the benefit moving forward. And then DHCS additionally conducted a doula benefit implementation report that really outlined how the benefit had been implemented over the past 2 years, including the number of contracted doulas, the increases that we've seen over the years, and the number of members who were getting these services. We recognize that the doula benefit, not everybody is getting all of the doulas that they want or need, and so we continue to have ongoing improvement efforts across divisions within DHCS to improve member accessibility to doulas. Next slide, please. Another policy change that was completed last year is around access to breast pumps. And so we were able to clarify and change the requirements for lactation management aids as a group of durable medical equipment, including breast pumps, nipple shields, and other equipment that kind of supports both of those group categories and replacement parts. And so we removed a prior authorization or a treatment authorization request on any sort of breast pump for all levels. And so being able to get a manual, electric, or hospital grade breast pump should now be hopefully easier for members to access without that TAR requirement. And then really clarifying that the breast pump should be able to serve member needs while balancing costs. So if that means having a wireless breast pump as opposed to a plug-in wall breast pump, we do encourage members or we do encourage plans to be able to cover a variety of breast pumps to serve member needs. Next slide, please. One of the significant policy changes that we've made in the past year is our transitional care services policy for pregnant and postpartum members. And so previous to this year, we had really only identified anybody who is admitted to a facility or transitioned in a level of care, so outpatient SNFs or long-term care services, et cetera, as high risk and low risk. And we really wanted to acknowledge that, pregnancy and postpartum is a very different time period than potentially pediatric and adult ongoing chronic care or even acute disease management. And so identified 2 additional categories specific to pregnancy and postpartum, high intensity and moderate intensity that you can see here on the left. And we'll go through a couple of criteria that kind of categorize these individuals, but really the goal is for high intensity members to get a single point of contact and a care manager within their managed Medi-Cal plan who can follow them from pregnancy through to the postpartum period and ensure all of their needs are met. So making sure if they get admitted that they are able to get their follow-up appointments either with their maternity care provider or with any specialists that they need, if there's any medications that they need or DME that they need, that they get connected with those, and really to help them navigate kind of life during pregnancy and postpartum, whether that's connections to other social services or within the Medi-Cal setting. And then for moderate intensity categorization, we want to make sure that members still get some of those same services, but that that may be contracted out to the clinical provider in order to provide those services. For both members, we've identified a birthing care supports checklist that is expected that every member kind of goes through and gets all of those services. And those include a lot of wraparound services that can support healthy pregnancy and postpartum, such as WIC, lactation, home visiting, paid family leave, and a bunch of other needs that people might have. And so the expectation is that all members are contacted and are able to get some of those, are able to get the services that they want and are eligible for. Next slide, please. And so thinking about who, how do people categorize into these 2 different groups, recognizing you can see here that the category or the eligibility criteria, for each categorization that we don't necessarily have to dive deep into, but really thinking about these higher intensity members as having more needs or higher risk conditions than the moderate intensity folks. And really here, what we want to lift up is that there's no lower risk category in the transitional care services for pregnant and postpartum members. We recognize that being on Medi-Cal alone is a risk factor for poor postpartum and pregnancy outcomes. And therefore, there's not a single member who is pregnant and postpartum that really should be categorized as lower risk. Next slide, please. Another significant policy was our risk stratification, segmentation, and tiering policy. And really what we're trying to do here is use an algorithm or learning models to predict who might be at risk for poor outcomes or adverse outcomes in both the prenatal and delivery period, and then separately in the postpartum period. And we use kind of historic claims data and predictive models to be able to identify patients that may not otherwise be flagged as higher risk or needing more support. And so we've created 3 different algorithms, one that predicts pregnancy adverse outcomes, again, prior to the postpartum period, including the delivery period. And then because we know that the majority of morbidity and mortality occurs in the postpartum period, we have 2 separate postpartum predictor models, one for physical adverse outcomes that includes some infant complications, and then a second one that really focuses on the behavioral health adverse outcomes, knowing that substance use and maternal mental health are really significant challenges in our community. Next slide, please. So you can see kind of here is just a little algorithm of how folks can get categorized based on what I just said. And this information gets transmitted to the managed care plans every month. And our expectation is that they are doing outreach for the members who are pregnant who have been identified as high risk to ensure that they are connected to services and engaged in clinical or behavioral health care, whichever both and with whichever they need. Next slide, please. And then the last really significant policy that we've published this year is an omnibus maternity all plan letter. And so as many of you may know, the ways that the all plan letters kind of direct managed Medi-Cal plans as to what the requirements are from DHCS and what policies are covered and how to implement some of those policies. And historically, a lot of the maternity guidance had been in different APLs and different policy letters and lots of different guides. And it was really hard for plans to know what they needed to do when somebody became pregnant or postpartum. And so we consolidated all of these guidance documents into kind of a one-stop shop that was released at the end of March for managed care plans on all of the maternity services that they must provide to pregnant and postpartum members, really to enhance opportunities to improve the quality of mental health care or maternal health care services that they provide. Next slide, please. And so here is just the listing of all of the contents that APL includes. And so it really defines how managed care plans and their contracted providers should be doing risk assessments and the follow-up for those risk assessments, how they access care, both for physician and midwifery care, the right to non-invasive prenatal and newborn screening, so genetic testing, and then newborn screenings that include also congenital disease screenings, but as well as heart screenings, hearing screenings, et cetera. Behavioral health services, so the right to access both non-specialty mental health services, specialty mental health services, and substance use services, and how those services should be coordinated across the delivery system. So having behavioral health plans and managed Medi-Cal plans talking to each other. Lactation services, so the right, as we talked about a little bit, to breast pumps, but as well for clinical lactation consultation through breastfeeding consultants, as well as breastfeeding education, doula services, community health workers, group perinatal care, which can be given a variety of mechanisms or frameworks, community supports, which really we're trying to emphasize all of the community supports, but there's been a lot of new work in the transitional rent and housing community supports package that would be able to help pregnant and postpartum people who have that need. Some of our population health management that we discussed, so the RSST and kind of risk stratification pieces, as well as our TCS, transitional care services policy, and then contraception and abortion access. And so all of the requirements for plans are detailed a little bit more, and knowing that members kind of have rights to the benefits that we provide so that they can have healthy pregnancies and postpartum periods.